Okay, well, I think that everybody already knows who I am, but let me just say again, I'm Sue Hutchins, the co-chair of Iowa Justice Action Network and also the founder of Living Beyond the Bars of Iowa. One of the things that we talked about when we were putting together this conference is that we would be spending most of our time talking about what needs to be done, what hasn't been done, what isn't working, and then something that needs to be working. So what this next section is about is something that's happening in Lynn County and other counties, but Lynn County in particular, that has to do with alternatives to incarceration. That is really a grassroots program and has been very, very successful. The people who are on this particular panel are from an organization called Fresh Recovery Center and also the Access Center, the Abbey Mental Health Access Center and Foundation 2. And I think that what I will do is just introduce, right now we have Kelly, who is from Foundation 2 and the Access Center, and we have Courtney, who is from Fresh. And I think I will just let them introduce themselves as they speak to you about their programs. And if we could start with you, Kelly, that would be wonderful.
That sounds good. Yeah, so my name is Kelly Zepeda. I am the program manager with Foundation 2 Crisis Services out of Cedar Rapids. I oversee our law enforcement liaison program as well as our mental health access center program, where Foundation 2 has staff here. It's actually a Lynn County facility though, and within it, I'll kind of tell you what we have. So I'll start talking about the Access Center. I'm kind of filling in for Aaron Foster, who's our director here, to kind of give you that information. And then I'll go into a little bit about Foundation 2's law enforcement liaison program. So here at the Lynn County Mental Health Access Center, we've been open since March of 2021. The goal and our mission is to provide 24/7 high quality crisis behavioral health treatment and support. And we're going off of best practice focused, recovery oriented, person centered. And we like to describe ourselves as a mental health urgent care, in the sense of it's a walk-in clinic in a sense, but from Monday through Sunday. So 7 days a week, 8 a.m. to 10 p.m. is when Foundation 2 staff are here. But all of the other services in our building are open 24/7. So when I say there are different agencies here, so there's Foundation 2, so we are the frontline staff. So when somebody walks in our door here, my staff are up front and we're called triage counselors. So somebody who might walk in with a mental health or substance use crisis comes up to the window, explains that they want to get some help. And one of my staff, who's a crisis counselor, will take them to a triage room, go through a few different assessment questions and some intake paperwork and figure out how we can help them. And we can make then direct referrals to our other agencies here at the Access Center, as well as community resources. So we work very closely with Abbey Community Health Center, who hosts 3 different programs within the Access Center itself. Those different programs are crisis stabilization, crisis observation, and subacute services. I will speak my best to those as not being a part of Abbey. The most popular one and most well-known service of theirs is crisis stabilization. And that's for individuals who are in a mental health or substance use crisis and can be placed essentially within our facility here at the Access Center. So they go straight from triage with my staff, just right next door over to crisis stabilization, where they can stay up to 5 days, depending on variables, whether it's funding or their willingness to be here. And it gives them a chance to kind of be in a safe spot to work with a mental health professional, work with direct support professionals, and kind of regroup, get connected to medication management, to therapy, peer recovery support services, things like that. Really wonderful staff who are part of that. And within that same part of the building, they also have their crisis observation beds, which are up to 23-hour stays, people in similar situations that we would normally place within crisis stabilization beds. But oftentimes we're using it for individuals with maybe a more acute needs, and where we're maybe trying to guess, or not guess, maybe we're trying to figure out whether or not someone might need a higher level of care, or if we can have them move over to the crisis stabilization beds instead. And so within that part of the building and that program specifically, it's run by a nurse with Abbey Center, and they stay in the room with the individuals. So they have eyes on the whole time, and can manage what their needs are. And if individuals need to go to the hospital or something, they're the ones who will take care of that for them and get them where they need to go. And I can only speak very briefly about subacute services, as Foundation 2 doesn't have a whole lot to do with it, but that is up to a 10-day stay at Abbey Services next door. And that actually is through a referral process through doctor's orders specifically. For crisis stabilization and observation, Foundation 2, through our mobile crisis, through our law enforcement liaison program, as well as my triage staff here, we are the primary source for placing individuals into these programs. We have a couple, I think there's 2 other entities who can do it. Doesn't happen terribly often. One is Community Crisis Services out of Iowa City. They're very similar to Foundation 2. Most of the time they'll place is if Guide Link down in Iowa City is full, they can place up here as well. So in addition to the Abbey Services inpatient, we also connect with Abbey Outpatient Services, which their building happens to be right next door, which is very convenient. But we work with them in terms of getting people set up through same-day access for ongoing therapy, getting into appointments for psychiatric services, medication management, things like that as well. And then the last service within our building is called the Sobering Unit, which is operated by Area Ambulance Service here in Cedar Rapids. And that is 24/7 as well. And it's staffed by an EMT from Area Ambulance 24 hours a day. This is one of the biggest jail diversion pieces of our building, I think. I mean, they all are intended to be jail diversion mechanisms, but this one specifically is for individuals who are under the influence of alcohol. We don't have a BAC limit for when people can come here, but our highest referral source is law enforcement, who they can bring individuals here who are under the influence of alcohol, and they can stay and be supervised by an EMT the whole time, up to 23 hours or until they sober up. And during that time, the EMT is looking for things to determine if someone is in a state of detox and might need to get medical attention, or if they're just needing to sleep it off and go home. But law enforcement particularly have the ability to, rather than putting individuals who are intoxicated in jail, they can bring them here to safely sober up and make sure that their medical needs are being monitored as well. So it's a really, really wonderful program to have that here also. Few key components.
Let me just ask you, is it only for alcohol?
Yes. Yep. We are currently in the process of getting a community-based medical withdrawal detox program set up. That's in the works. The Aaron Foster, our director here, is obviously taking the lead on that one. And I don't have a time frame, unfortunately, of when that will be up and running. As far as the 3 main components of individuals that we cannot serve here, we are regulated by Iowa Code as well as the Department of Human Services. And so we can only take individuals who are adults 18 and up. Individuals in need of immediate medical care cannot come in because we don't have medical staff on site. Although we do have nurses at Abbey Center and EMTs and such, we don't have somebody to do that ongoing medical monitoring. So if someone has a big gash on their face or something, they come in, we might send them to the hospital to get that addressed, but they can come right back and have our services offered to them here. And then lastly, for safety of everyone in the building, we just can't have people come in who are violent on arrival or immediately or prior to arrival with a likelihood that they'll be seriously hurt themselves or other patients or employees. And all of our services, big component too, is that all of our services are voluntary. So somebody can come in, get placed at our stabilization services or sobering, but 5 minutes later, if they choose they don't want to be here, they can leave at any point in time. And so they have to be agreeable to that. And that is something that we, as my staff through Foundation 2, work with people pretty closely to explain the services well in the triage process to make sure that they're able to commit to the plan for the stabilization services and whatnot. Through this program, if what would happen if we succeed is it would have a lot of de-escalation of patients. We triage patients to address their current needs. We have warm handoffs, what we call it, from our team with Foundation 2 to specific treatment needed. And that, like I said, works pretty smoothly coming from Foundation 2 staff to our other agencies within the building, as well as our community resources in town. My staff are constantly looking up new providers in town, getting their information so that we can provide that to clients when they come in. Foundation 2 also does follow-up care as of the other agencies in the building. So we will do, Foundation 2 does 48-hour follow-ups from individuals who are discharged to the community rather than going to any of our other programs. And all the other programs do their own follow-ups as well. These services are intended to also divert from utilization of the emergency room for individuals who may not meet the criteria for being admitted to the psychiatric unit or something like that. And unfortunately, here in Cedar Rapids, at least, I know that we experience a pretty high acuity level of individuals with mental health needs who, when they're going to the hospital, unfortunately, they might be staying for a quick minute to be evaluated and unfortunately are being sent back in the community. And lack of resources is a little bit difficult to overcome, but we are an option to work with them and at least see what we can do to help them and kind of keep communicating with them at that point. So that's kind of the overview of the Mental Health Access Center. If you want me to wait until I go over the other program to answer questions, if anyone has them, I can do that.
I think it makes sense to wait and talk about the other program. Yeah.
What did the police have to say about the program? Are they happy it's there, or are they cooperative?
I think that's what she's going to talk about next.
Oh, okay.
Yeah, I can kind of go over both of that because it's really quite awesome, actually. So Foundation 2, with what we do in our involvement here at the Access Center, as well as my law enforcement liaison program and the mobile crisis program, it all kind of works together in a really awesome cycle of creating these continuity of care for individuals. So the law enforcement liaison program is one of my favorite things to talk about because I'm super passionate about it and my staff are fantastic. So the gist of it is we are working off of a co-responder model where mental health clinicians, for lack of a better word of saying it, they're crisis counselors essentially who are embedded within law enforcement departments whom we contract with. So they're kind of another layer of support with our services, in addition to the crisis line where we operate 988 for Iowa, our mobile crisis teams, as well as the Access Center. We currently have liaisons embedded within 7 different law enforcement departments within the East Central region. So we have 2 liaisons at the Cedar Rapids Police Department, one with Lynn County Sheriff, one with Benton County Sheriff, one with the Marion Police Department, Hiawatha Police Department, Dubuque County Sheriff, and the Delaware County Sheriff. Our program is unique in that each individual department's liaison program operates differently. And really their liaisons are to be used pretty much at their discretion and situations that they feel they're appropriate to include them on. Cedar Rapids was our pilot program, and they are unique among all of them in that they are the only true team model, team co-responder model, where they actually have a mental health unit where an assigned officer works with my 2 liaisons to co-respond in the field, whereas the other models operate on what we call a mercenary model, where the liaisons are shared among all deputies or officers within the department and get called out to mental health or substance abuse or other crisis calls with any of those officers at that time, whereas those calls to CRPD would otherwise go directly to this unit. And so what we have found and kind of how the purpose of these co-responder programs, which is really blossoming and growing across the country extremely fast right now, is it's intended to divert individuals, again, from jail and from the emergency room if those are not necessary places to go. One thing that's important to know about the liaisons is they are essentially a tool in the toolkit for law enforcement. We don't make the final call. So kind of what these liaisons do, or the main purpose of them, is they will do live dispatches with law enforcement on calls where someone might be experiencing a mental health crisis of some sort. We don't define what that is. and they've done a lot of things outside of strictly that realm. But when they're doing it, they're going at the same time that that 911 call came in, and they're going out with officers, and they're working with the clients at that time to de-escalate, to kind of act as an outside representative to support their needs versus law enforcement. So my liaisons wear Foundation 2 attire, plainclothes attire. They don't look like officers. They don't drive squad cars. CRPD will ride along with their officers sometimes, but again, they're plainclothed, and all of our other liaisons have their own unmarked, typical looking cars that they do. But when they're on scene at these calls, they can advise the officers or deputies on what they think would be in the best interest of the client, or what the client may need based on their expertise. But obviously, if there is a criminal component there, and if it's a safety issue or whatnot, it's still at the discretion of the officer or the deputy as to whether or not they need to go to the hospital, jail, or something else. So we're really acting as a way to guide and help law enforcement make these decisions to serve individuals better and meet their specific needs. So some of the benefits of our program that we have found, and that co-responder programs overall are intended to provide, is it diverts calls to liaisons rather than to 911. So a lot of what I'm seeing with my folks is they might go on an initial 911 call one time, and from that point on, that individual who they responded to is going to start calling my liaison instead of the police moving forward. So it's saving time for officers to do anything else really, while the liaison can do ongoing support and services for that individual. They also continually are doing educational outreach such as this, presenting at conferences. Our CRPD liaisons are actually trained to facilitate CIT training. So they regularly will coordinate that with CRPD to train new officers from around the region to do that. And then they're also connecting with clients who are otherwise isolated from different services. One thing that's nice about our program specifically is we don't have a billing mechanism in terms of billable minutes or things like that. So in our rural counties like Delaware and Benton and Dubuque, we can go to someone's house and meet them where they're at to see what's going on, whether it's a follow-up or that initial dispatch, things like that, and get them connected with them to services nearby, help them figure out transportation to those services, things like that, whereas otherwise they might not have that ability to do so. It decreases the encounters with criminal justice system, so fewer arrests and improved jail diversion. Reduced costs as far as fewer repeat calls for service, reduction in civil lawsuits, reduction in time spent on mental health calls. And then we do a lot of, again, cross-training opportunities. So all of my liaisons are trained in CIT, ASSIST, which is suicide intervention training, as well as mental health first aid and some other smaller trainings that Foundation 2 requires. And then as a part of what they do, they coordinate with all of our other programs. So they will work with mobile crisis, they'll work with our access center staff, they'll work with our crisis line, with our youth programs, things like that, to communicate and figure out what's been done, what needs to happen, how we can not duplicate things that have happened for an individual, but continue their line of care. And so when I say that they respond to mental health or substance use crises, that sounds like it's pretty limited, but because of the, I guess, discretion and autonomy that they have, they're able and have responded to quite a few significant things that you wouldn't necessarily think of. An example I have of that is our Lincoln County law enforcement liaison assisted with a family whose child was unfortunately swept away in a river here over the summer. And so he worked with the family for about 3 or 4 days consistently while the sheriffs were able to continue their search, do what they needed to do, while he worked with the family to provide support to help get them whatever they needed, contact family members, anything they needed, really. He was there just even as someone to listen. They will go out on domestic violence calls. They work a lot with individuals who are elderly, who may be unable to care for themselves or who have dementia and have come in contact with law enforcement. family conflicts. They've gone on DHS removals. They go to schools and work with youth a lot of the times as well. They have done voluntary and involuntary mental health and substance use committals for people who they've had regular contact with. They can help with transportation in terms of some of them will provide rides to people who are safe to do so if they need to get to an appointment and don't have another option. And I mean, pretty much anything, any behavioral health scenario you can think of, they have probably responded to at some point in time. So it's really cool what they do. I'm looking at our reports right now that I don't even know how I could show it to you, but essentially they're from our last quarter that shows the number of calls that our folks have gone on. So last quarter, Lynn County Sheriff's went out on, our liaison went out on 55 crisis calls and 111 follow-up calls. And that's over a 3-month period. And then CRPD liaisons went on 86 crisis calls and 186 interventions. Interventions are essentially crisis call or dispatch. The only difference is maybe a time delay because the liaisons work typically like 8 to 4, 10 to 6, something like that when other agencies are open for services. So they might get referrals from an officer that night that they get contact, where they'll email them the situation the next day and ask them to make contact. And then 47 follow-up calls. And that's pretty much all I have about the liaison program in the Access Center.
A quick question, Kelly. Do you, if someone does get sent to jail, in spite of everything, can you work with them in jail?
Yep, absolutely. So because Lynn County Sheriff's, obviously, they operate the jail. It's part of their county stuff. Our Lynn County liaison does a lot of our contacts here with individuals in jail, as well as our Benton County, Delaware County, and Dubuque County liaisons all work pretty closely within the jails as well.
Hi, Kelly. Do you have any financial assistance that you're able to help the clients with?
Not specifically from Foundation 2 in the sense of providing actual tangible resources to people necessarily. But what they're really good at is being scrappy. And so they know connections in the community. They know who to call. They can find things for people if they need them. If it's something small and they're trying to build rapport, if somebody needs a meal that day or something like that, they can sit and have a meal with them, things like that too. But as far as like clothing, things like that, they'll get them connected to what they need the best that they can with the resources they have.
And you also mentioned that you can help people that's going through domestic violence. Do you partner with any of the domestic violence agencies in Cedar Rapids?
I don't know if I'd call it a partnership as much as they're sort of one of our allies in terms of Waypoint specifically is one that they work a lot with in terms of getting survivors of domestic violence connected to that advocacy after the fact. Because a lot of times if they're responding to that domestic violence call, they're there right after it happened. And so they're there to support those individuals when they're going through a really hard time and to kind of help de-escalate the situation. And then they can connect if they're willing to Waypoint or other services in town.
Okay. So what would you say your population that you work with? Is it more people of color, Caucasian?
You know, that's one of the demographics I have not filtered out yet. We just switched to a new record system as of November 1st. So that's something I will be able to collect here shortly to get bigger picture. I would say though, it's pretty much everything across the board. Yeah, it's really just depending on the person's crisis because it can be something super small, like a kid having a hard time at school who might be suicidal, from any walk of life to someone who lost a child in the river, for instance. So,
and I asked because I have an agency in Cedar Rapids, Amani, and so we do domestic violence services for African Americans, and so we're always looking to, you know, help more clients in that area. And so, being a nonprofit is sort of hard, you know, when you have other nonprofits there and different things like that. And so I'm not saying that I'm not able to collaborate with agencies down there, but I just want to get the word out that, we do have services. We do have some unique things that we can help our clients with. So I want to be able to help those clients that look like myself.
Absolutely.
You two might want to talk with each other.
Mm-hmm. I'll put
Yeah, if you want to shoot your email and phone number in the chat or to me, that'd be awesome.
I've heard of you guys.
Are there any other questions? Well, thank you very much, Kelly. We really appreciate you coming on and talking about this rather innovative program. And I personally am very glad that it's in Cedar Rapids. I'm glad that it's in other counties, in other cities, in addition to Cedar Rapids. And I think you guys do wonderful work. And your work with the police officers is awesome.
Well, thank you. I appreciate it. Thank you for having me.
Yeah, it's wonderful. Thank you very, very much. Next, we will hear from Courtney, who is part of Crush, and I will let her explain exactly what Crush is and how it got started and what she does there. So Courtney, I will turn it over to you.
Thanks, Sue. So yeah, I'm Courtney Hammond. I am the volunteer coordinator at Crush Recovery Community Center. I've been there since about November. Started volunteering there when I was in July, when I lost my job due to minimum jail time. So it was kind of a good fit. It was like a door open and a door closed, and I was so devastated from this jail time that this door opened, and I was so grateful. And I just kind of clinged on to the program, and they cleaned on me back, and we've just kind of grown. So Crush started about 6 years ago when Deb and Rod lost their son, Chad, to fentanyl poisoning. And from there, they have just grown this huge community center for any type of recovery. And when I'm talking recovery, I mean like sex recovery, gambling recovery, eating recovery, any kind of addictive behavior. We kind of are the buffer between formal treatment and or other professional services. It's just a community full of recovery. There's no specific pathway that we support. We have multiple ways to cater to your needs. We have smart recovery. We have all three of the 12 steps, which is CA, NA, and AA. AA just started last week, and that's it's been a really good turnout. And we also do creative coping skills class. Me and Sue have recently done our first round of repairing relationships, which is kind of an all across the board, how to get those relationships back with our kids, our families, our loved ones, even our close friends we were with before use or after use. We kind of me and Sue kind of came up with curriculum to bring those all together, where we integrated the kids and family together as a whole. And it went over well. We also have, and this is important, we're all peers. So I'm in recovery. All of our, staff, all of our volunteers have some sort of, life experience that's led them up to be a part of the center. And even for the families who've experienced the significant loss, who has to deal with the child who's an addict or who, anybody, it's a huge family kind of engagement place. Because we know as addicts and recovering from, our addiction, we'd have to recover our family as well, because they get dragged through the mud just as long as we do. And we have a referral process. It's actually a drop-in center too. So if you're struggling one day and you just need to get away from somewhere and have a safe space to be, Crush is the place to go. We don't have appointments. I mean, you can make one, but we prefer if you just drop in and say hi to us. You will never, ever feel lonely there. And if you do just want to be alone, we have, our conference room, and then we have the hutch that we have coffee. And we just got a popcorn machine the other day so people can come up and enjoy popcorn. It's more of like a homely like environment. We have couches, we have soft music playing, we have a toy room for the kids that's filled to the brim with toys right now. Lindsay Powers is our police liaisons. She's not there so much anymore because of her other work she does. But she has been a huge help with like keeping us up to date with what the community needs, you know, and if there's somebody like, oh, we had an overdose last night, you know, we'll try to reach out to the family and to the person who's going through this, and we will kind of like cover them with our warm blanket if they're willing to. And this is a no obligation place, 100% volunteer. You know, there's no obligations, there's no financial obligations. We're nonprofit. And just come up and talk to us, have a cup of coffee with us. Rod and Deb, they're the nicest people ever. You'll never have a boring day in our office. A lot of the people now that are coming up to volunteer since COVID restrictions have kind of lifted is drug court and from the center. We do warn there, me and Susan do. So we support reentry, or the buffer between the probation officer, the courts, you know, where am I going to find this community service at? Where am I going to keep busy? And they can just come up to the center, and it's a real kind of simple, you know, volunteer interview process. You know, but all we do is promote, you know, the next best thing. And even if you fall one day, like, oh man, I just relapsed. Oh, I just had messed up. You know, we're not going to condemn you of that. We're gonna praise that you just came up here from that, and we're gonna go and try. We're gonna keep chugging along with you. You know, there's this saying that, you know, professionals and psychiatrists, you know, they'll all go by an addict and, you know, try to help them the best they can. You know, an addict and another addict will get in the hole with you, and we'll sit until we're ready to get out of that hole together. And we really kind of hold that true, you know, and we hold us to our standards because we don't let anybody left behind. You know, we all have bad days. We all mess up. It just depends on how, like, what we've learned from those mess ups and move on from it. Our peer recovery coach supervisor isn't on here, and I don't want to like steal her thunder, but you know, we do have peer recovery coaching, and everybody has like the, you know, required amount of clean time or sober time can fill out the application and get trained to be a peer recovery coach. It's offered through CCAR and it's paid, and then you can just start working with the community and helping be an advocate and helping another addict with another addict. You know, what's said in the 12 steps, it's without parallel, and it's true, you know. So we really hold those to a high standard. You know, if we're people that know where we've come from, and do everything we can to support that process of the future planning. We have the Unitas just kind of came in and trained us the other day, and so we have referrals from the Mental Health Access Center. We send referrals there. You know, we have ASAC downstairs, and we have walked so many people down to that office together, you know, as a team, and walked them to that next step to get an eval. Getting clean and sober is scary, you know, and it's kind of what really is kind of the thing about getting clean when you're out there for so long. It's so hard to gather up the courage to say, yes, I've admitted I've done this, I need help, you know. And we are the biggest advocates for saying, okay, we're going to help together. This is what we do as a team. And we work really closely with veterans. We just now recently had, we have a group of veterans. We don't want to call it like necessarily like a support group, but like a peer group, because I can help them all day long and I, you know, love them for their service, but I really have no idea what it's like going to war or getting deployed or being part of the service. So we have 5 volunteers now that are in the middle of taking peer recovery coaching, and they are going to be like our veterans, and they're going to assist other veterans. And that group is growing spectacularly. We got a young kid who just got out of boot camp. We have the Army, the Marines. We have some women and men and some people of color too. And it's such a huge, beautiful thing we've built here with the veterans as well, because we're going to start working with the VA to help do the buffer between what do I have to do with the government and why do I feel this way towards it. You know, we're here to kind of, you know, give you that little cushion and that safe space to say whatever you feel and to feel whatever you want. And what else do I got?
You work with Department of Corrections?
Oh yes, yeah. So the Department of Corrections. So we do the warn, and a lot of our volunteers right now are coming in from drug court and into the Heinzman and Nelson Center. So we have a lot of them coming up, just trying to, you know, keep them busy. We have a girl right now, I can't remember her name, but she's from the lab library. She's going to come up and start doing like resume building courses for free for these people who are coming back into, you know, civilian life and back to regular life to try to get a job. We always say more felonies, the better. It's actually resume builder. It's just kind of an inside joke. But we don't, you know, life happens, and we need to assist those people who are actually trying to get back out and trying to make the best of their life. And what else am I missing, Sue?
and the peer recovery coaches.
Oh yeah,
Susan is the
yeah.
Yes. Would you talk a little bit about that, and then also talk about the family partnership?
Okay.
Parenting partners.
Okay, yes. So, like I said, I feel bad because Susan needs to be here doing this, but so she's this peer recovery supervisor. She goes into ASAC, Maine, and Heart of Iowa, and the center, and she does peer recovery coaching. And we actually have two, I almost think two for sure, that are still in the Heinzman Center or still actively in drug court, that are facing time, that are doing this peer recovery coaching. And they have made the growth of our Department of Corrections so much bigger, because, you know, you see this one person doing it and they want to get involved. So, I mean, it's a beautiful thing. We're trying to get involved with the Anchor Center. I believe Stacy came up last week for a tour, and she's kind of like the treatment. I don't want to misquote myself, but I think like the treatment coordinator for DCS. So she's going to start referring people to come on to or come up to us and see about getting involved in the community, you know, because what we lack, you know, when we get out is the connection to our community. You know, we just got out doing a stint. We have no real big connections, and we're real big on connections. So we will make the connections, and we'll help you, get those connections too, and move on from there. And then I'm nervous.
Well, can you speak to people who have actually had their sentences diverted, either because they have reoffended or because they have offended for the first time, and because of being involved in this program, or the family parenting partners, they did not lose their children? Can you speak to?
Yeah, so I'm a good example of that.
I'll give
you a little my morning. I just went to court this morning because I had 40 days or 60 days minimus time I was supposed to serve before COVID had happened. And because I've gotten in this program, the letter that, you know, my involvement in here has made that judge look at me like 100 or 360 degrees. You know, he said, I see your growth. And this guy wanted to throw the book at me, you know, and prior to him seeing me this morning and seeing the growth I've made because of this center and because of parent partners, you know, he's letting me go on how we continue to be around children, and not lose my job, because our whole point, you know, when we get here and we reoffend, or we just can't get, you know, our lives to somewhat together in a well-oiled machine, we're bound to mess up. You know, I will admit that I'm terrible at not driving. And that's what my latest charge was. But because I'm involved with the center, and because of the involvement I have in our community, the judges are really looking back at that and saying, okay, they're making connections with the community. Let's find a different way besides throwing them back in the jail. And I feel like, you know, a lot of the sheriffs down at the Linn County Jail, like they've seen the growth I've made, and the sheriff that recently, like 4 months ago, picked me up new rod from back in the day. So it was just really good to see that growth. Parent partners, on the other hand, so I'm the lead partner also of the Linn County Service Area for CFR, or CFI, I mean. And the involvement we have is that we have an office there, and everyone and anyone who has, you know, can't keep a clean patch, or has just fallen down repeatedly and can't just, you know, keeps getting charges, you know, they'll come up to the office, they'll feel the involvement of the office and everyone kind of involved in the center, and the judges look at that like it's a really big thing. You know, we're ready to have one of our parent partners on the family treatment court board, and you know, Judge Briner and Judge Finley, they're just amazing human beings. They're dedicated to keep the families together. Is just a beautiful thing to me, especially when it's DHS involved. When everyone thinks DHS is involved, they want to run the other way, or you know, there's so many hoops to jump through that you can't do it. But with the center and with the partnering of parent partners, you know, we kind of, like we always do, you know, we always driven, we always kind of have, like, you know, we're always yelling down the hallways, hey, what about this? You know, and we're always making a solution based you know, focus rather than continuing to stay in the problem, to keep putting these people in jail and keep piling charges on them so that their life is completely messed up, that they can't even keep their court dates, you know, together. So I don't know.
Well, and if I could just add, this whole organization really is a grassroots organization. Started, like Courtney said, with Rod and Deb having lost their son to fentanyl poisoning. And it started out as a support network for families and addicts, and then developed into Deb and Rod writing a grant through the Department of Health and Safety, and opening this particular recovery center, which was the first one in Iowa. I think that merits saying. And Deb and Rod are extremely dedicated to this. Rod is a retired probation officer, and so he knows the system, obviously, and was able to make some of those connections to help with the diversion of keeping people out of prison and or jail, not only for their recidivism, but for first charges. And that's one of the main reasons that I wanted to share this information with Iowa about this particular program. There is another recovery center in Des Moines that's called Full Circle. And they also have a satellite office somewhere else in the state, but I can't remember where their other satellite office is. But in Sioux City, but they've been open for a little bit less time than Fresh has been open.
Yeah. First video is like
somebody else is talking. I do want to speak for just 1 minute on Susan's behalf. She's the peer recovery coach specialist there at Fresh. And one of the things she's doing separate from her job at Fresh, she's in the process of, she's put together a board of directors and is developing a 501c3 to open a recovery house for women in Lynn County, preferably in Cedar Rapids, maybe in Hiawatha, because there really just are not many places in the state of Iowa for women to go to that are not when they are released from prison or jail. So that's something also that's a grassroots piece of community resource. And I think, and in Iowa City, Inside Out is also in the process of opening a house for people who have returned from prison in reentry, and most of them they don't have family to go to. They don't have, their recidivism rate is very, very high if they don't have family to return to, if they don't have support. And so that's what Inside Out provides for them, is group support. And they're going to be opening a house in Iowa City for people to be able to live for up to 5 years, I believe. And I'm not certain that Susan's decided how long people can live in the house that she's thinking of putting together. But those are the kind of things that are happening from grassroots. And that's really where a lot of this, we've looked to the government for years and years and years and years to solve some problems that finally we have begun to realize can be solved best by the people who are affected and grassroots kind of help and movements. So that's really all I wanted to say.
Sue, sorry, I have also something I forgot. Okay. So we just got the new at Crush that we're going to be able to start being in the emergency room on call. So
good.
Yes, I was gonna call you yesterday to find out. So they're actually gonna have, there'll be some stipulations. There'll be a lot of, training. We're also doing the assist training. And our peer recovery coaches are going to be able to be on call with the police officers, with the emergency room, holding the hands of these people who are still struggling. And, we have 200 people a week come in our office, if not more sometimes. And I'm going to say 98% of them have open cases and are facing jail time, myself included.
Right.
So it's just a real program to be able to wrap yourself in.
Thank you very much.
I had a question for both Courtney and Kelly. I mean, do you feel like that the demand exceeds your capacity to answer? Do you feel like you're sometimes turning people away because you don't have the staff? Because the hundreds of people are being churned through the criminal justice system. I'm thinking that it could be more than you can deal with, but I just wonder what your perception is on that.
So we have over 20 active volunteers, 4 paid staff, and we are open with our with our calendar events. We are open from 8:30 in the morning to 8 o'clock at night, 3 days out of the week, and from 8 o'clock in the morning to 5 in the morning on those days that they're not open till about 8 at night.
5 in the evening.
In the evening. And so I've never turned anybody away. We have so many returning people that the state is so impressed by our rate of returnees and new people. Once you come in the center, you kind of just keep coming back. It's kind of like another second home from home. So I've never turned anybody away, and I don't feel like it's a huge thing for us.
Yeah, I would say for the Access Center, we haven't turned anybody away due to demand or anything like that per se. If individuals are leaving from here without being, I guess, served anyway, is typically because they've become aggressive or something like that, or we just can't provide the services that they're looking for, like housing resources we can give information about, but we don't actually work to connect people with housing in that way. We're intended for mental health and substance use crises. But we don't have, I wouldn't say an overflow in demand. And we're constantly doing outreach to spread the word about us because we're still newer, to make sure people know that we're here too. And with the liaisons, I would say I think they're meeting demand pretty well. It's just a matter of whether or not the law enforcement departments are utilizing them as much as they could be. And that's oftentimes the barriers, which officers or deputies buy in and which ones don't. And as long as you have those individuals who do, they're going to continue to ask their liaison to partake in their calls. So.
Yeah, and I don't know if I know we hear about bottlenecks in mental health treatment in this state, shortages of therapists and so forth. I don't know if your work is affected by that or not. I mean, if somebody does need to be, hospitalized, are they having to wait to get in or wait for psychiatric services? I mean, that's something we hear all the time. I don't know whether you've experienced it or not.
What I am hearing the most from all of the services within Foundation 2 and the Access Center is the bigger issue is individuals who are needing hospitalization are being sent back out pretty quickly, even after getting committed involuntarily or voluntarily. I guess in my opinion, if someone's at that level where they need that level of care, and then you're sending them out without getting that level of care, a lot of times individuals expect that the Access Center is the next step. And we wish we could be, and in some instances we can, but often that is a higher level of acuity than we're equipped to handle. And I would say that's more of the bigger issue. And I think overall too, there is absolutely a lack of psychiatric providers in particular. So people who can do the med management, that has been a huge barrier. Getting people in within earlier than maybe 2 months is really difficult to do. And people who are released from jail, of course, don't necessarily have the connections to get their medications upon release. And luckily we do have, with the Access Center, we actually work really closely with His Hands agency, which I guess assists individuals with reentry and getting them their like emergency medications and things like that. And so that's actually been a really great partnership too. But yeah, short answer is yes, there's absolutely a lack of.
Yeah, from other people we've heard about this gap. If you're in prison and you're getting medication, and then all of a sudden you get out and you have to set up systems to acquire your medication, and meanwhile, you may not be getting the medication you need while all this rigmarole is going on. I don't know if that's what you guys encounter or not, but
yeah, absolutely. Especially when individuals coming out of prison or jail oftentimes don't have if they're reliant on Medicaid or something like that. If I'm remembering correctly, I don't think that they're coming out with that coverage. And again,
Right.
His Hands actually helps people fill out those applications pretty quickly, and which is really, really wonderful. And as you can imagine, they're getting, I think, pretty swamped quickly once the word about them got out, which is wonderful. But again, that's one entity, and we could always use more, but it is 100% a giant gap in services for individuals.
Well, and I think also that the free clinic can provide some psych meds for people during the interim of when they're waiting to get their Medicaid.
Well, I'm glad. I mean, I remember we had a woman that was active in IGN for a while, and she just went through this incredible hassle her son was coming out of prison and trying to get him the proper medication after he was out, with the fear that if he didn't get his medication, he might do something that would just send him right back in, and wanted to get him on an even keel in the community, but having a really hard time getting that set up. And I mean, that's something that we need to deal with,
Well, and Courtney, you had something that you wanted to say?
Yeah, so the question was from Jennifer. So the great thing about Crushes too is it's all peer ran. We do have a brand new class starting February 7th at 7 p.m. He is a military veteran, and he also is trained in trauma enforced care, I think, but he does like grounding techniques, guided relaxations, and he kind of focuses on the PTSD and trauma kind of trauma-based community. So it's going to be a huge turnout. I've already got all the slots filled. So we're peers, so I don't want to use any like clinical or professional words, but coming up there is super therapeutic anyway. Oh, it's the therapeutic value of one addict helping another addict, and then someone who has been through it as well. And all our services are free. So a lot of people will come up there wanting to see, like, oh my gosh, I just can't take this no more. Like, I just feel helpless. I have a lot of PTSD. Well, we're going to call in one of our veterans, and we're going to say, hey, we have this person here. Can you come talk to him? They're immediately going to come down and take them, and they're going to just work together on working through that PTSD. Because like I said before, we work together through everything, and we'll really we'll be there, and we'll make referrals on. The VA is not the only deals with, I mean, I feel like I need to do better as somebody part of the community. I lost my son's dad to an overdose, and it was mostly because he had been deployed during active war. And I really love to reach out to veterans, and I like I said, I can't tell them what it feels like, but I have people who are at my disposal at any time to come in and help those people work through that PTSD and trauma. And even with the domestic abuse or the sexual abuse or child abuse, we have such a diverse community of peers who are willing and wanting to help others work through those same things, that I don't feel like we've left any rock unturned. I deal a lot with domestic abuse. I have a lot of the parent partners who've gotten their children removed because of domestic abuse. And if someone comes in, a quick phone call, boom, 5 minutes, they're down at the office helping this person work through those problems. So that's another great thing about Crush.
Okay, are there any other questions or comments?
Do you guys have any financial assistance to help the clients? Well,
so we don't have financial assistance. We're nonprofit, but like I said, Kelly, is that her name? Kelly said, we have tons of resources at our disposal where we can help push them on to the referral process or to get them the help they need to get food boxes, clothing, diapers, gas cards. I've helped a couple people get gas cards, bus passes, food boxes. And with this Unitas app, we just have this new referral thing. We just have it set up yesterday that we were able to send out referrals, see what they need to the documents, take the documents, scan them over, and get them the resources they need almost immediately.
And there are also a couple places in Cedar Rapids that will help people get furniture.
Furniture Rescue is one Parent Partners works with very closely. Furniture Rescue is an outstanding place.
Right.
So I don't know if you were, if I thought Lisa's question was about the payment. And do you charge for your services, or is it all free?
It's all free.
All free,
All
no
free.
financial
So,
obligation at any time.
okay.
And like you can opt out of it. So if you have a peer recovery coach and you're just not clicking with them, or they're just not serving what you need, go to Susan, come to me, come to Rod. Susan first, because the chain of command there. Say, hey, I'm not mixing with this person. I want someone new. Boom, you'll have a new person assigned to your case the next day, almost immediately.
Well, maybe I misinterpreted your question, Lisa, but I thought you were asking a slightly different question that people were answering.
Oh.
No, I figured since they're nonprofit, they can't charge, but I just want to continue to share my information, because we do have some financial assistance sometimes that we can help the clients that are going through domestic violence, or like I'm sure both of you guys programs, most of those people do have some of that background. So if you could put your information, I can have my staff mail out some of those brochures as well, so they can know about Amani, because we're in Cedar Rapids as well.
So that might be another resource for you, Courtney, and also for you, Kelly.
Yeah, no, thank
you.
And me, because sometimes the clients have those issues, like you said, and so, we'll have somewhere to refer them as well.
Awesome.
Right.
Thank you so much.
Right. I also know that Living Beyond the Bars has just referred their first person who's coming out of prison to the program, and I'm pretty pleased about that.
We're also working on getting Core Links. So I have a Core Links account because I have a lot of friends that are in prison. I love them regardless where they're at in life. And so that kind of introduced that to Rod and Deb the other day. And they're like, what do you mean? And I was like, well, you put money on it. You kind of, you type them back and forth and they can call. And so that's in the works too. I'm just trying to make it, trying to get it to where it's like me, Susan, Deb, and Rod, and all of our peer recovery coaches, whoever can get on the app as well and contact their peer recoveries or guests inside the bars. I know my little brother, he just got out of doing 4 years. He's 22. And, he was the kind of your stereotypical reoffender. And I'll say, cause it's my little baby brother there, but he just could not connect with the community. He could not keep a job. He just was so, he's so young. And since I'm part of this, he gets the benefits of being a family member in the program, and that's available to the community. And he's so gun-ho about being a better man. He's taking care of his children. He's working. He's looking towards the future, and he's staying out of trouble. And he's got, I think, 4 weeks out of the halfway house today. So,
good.
Yeah. And we had our whole family together for the first time ever last weekend. And it was such a beautiful little ceremony to have our family whole again after 10 years of just craziness.
Yeah.
Mm-hmm.
All right. Well, I guess we can have a slight pause before we get to our next panel.
Did you guys answer Jeff Grill's question? I think Jeff had a question in the chat.
Okay. Let me see.
So as of right now, since I'm at home, I was on the road. I didn't go to the office today. If Jeff wants to put his email in the chat, I can definitely send him over those stats tomorrow, and we can get that information to him.